Dental implants are no longer experimental treatment, dental treatment. They are state-of-the-art. They are what standard of care is what I would say. A person missing teeth traditionally might look at getting a bridge, which is not a bad option, but it certainly is it's a more traditional option is what we say.
I had a lot of teeth that needed to be replaced. I had upper and lower partials, and I wanted to know about the permanent implants. It's really marvelous. I like what they did for me. I like all of the employees. Dr. Stu is just great.
Bridges are difficult to take care of, plain and simple. The reason that patients lose bridges is they are unable to take care of them. They're more susceptible to decay, and when they get decayed, you have to remove the entire prosthesis. So you take a 1 or 2 tooth problem and make it a 3 or 4 tooth problem by putting a bridge in there. You will probably invest a third more in a dental implant than a traditional bridge, but it should be the last time you ever have to deal with that space. Normally, if a patient was to come in with a missing tooth and wanted a dental implant, the process would involve a diagnostic workup to include a CT scan. That would be a 3-dimensional reconstruction of their jaw, where they're missing that tooth. We would talk about the financial aspects and the surgical aspects of that. The patient would then be brought into the office, oftentimes with a bit of a sedation that helps them relax, takes a lot of that anxiety out. And then through a minor surgical procedure, a dental root form or a dental implant would be placed into their bone. As I'm talking with patients, I tell them if they've had a dental extraction done in the past or completed in the past, they probably had more discomfort than they will with the dental implant placement. Typically the patients will be sent home with pain medication if they request. Oftentimes they don't need it, it's that minor. The patients are then seen on a regular basis at a week and a month interval to make sure that healing is going well. And usually after 3 to 4 months, that patient is ready to then begin the process of making the crown on top of that dental implant or the denture, whatever it may be.
I think that the value of the implant far outweighs any apprehension people have about putting in a titanium peg. The value is definitely well worth it.
Dental implants are as close to natural teeth as we can do as dental professionals. Patients use them like natural teeth. In terms of taking care of them on a daily basis, you take care of them just like you do your normal teeth. Brush and floss around them, keep them clean, and keep coming in for good dental visits, hygiene visits, and you should have no problems at all.